because we found that doing sustained, prolonged, repetitive work in an awkward position, like, say, for example, weeding, these are the kind of things that can predispose one to problems of the back. So rather just take a few different things and split your time up amongst them.
David Evans, talk to me about lifting.
I agree with James. I mean, obviously, if you're going to lift really heavy weights, you need to be very, very careful with your technique. But if you're going to lift fairly moderate, fairly light stuff, just be aware, as James said, that if you start on a task that you haven't done for a little while, then your muscles aren't as conditioned for that sort of task as someone that does it for a daily job. So, just take care, really.
We've got 8 minutes if you want to get through. 08453 00 9956. If we can help you, we will. If we can point you in the right direction, we will. 08453 00 9956. TENS machines. One of our listeners says, what is a TENS machine and can it help with back pain?
TENS, it stands for transcutaneous electrical nerve stimulation. They're very useful because obviously they aren't pharmaceutical, they're not drug-related pain relief. So as long as you haven't got a pacemaker or any other reason for not using it, there's no side effects, to be honest. There's very few side effects. And you can keep it on actually for a large part of the day. The problem is, as soon as you switch it off, it stops helping the pain. It's not really a lasting treatment, it's just a solution for some sort of pain relief. But they are useful, and certain individuals find them very useful. Some people don't find them particularly helpful, but you certainly shouldn't be paying more than about £20 or £30 for a unit to try out.
James, have you had any dealings with TENS machines?
Yes, we have them. Sometimes we recommend patients who are acutely suffering to use the TENS machine while they're undergoing chiropractic treatment, just to alleviate with the symptoms in the short term. But as David said, it's not a long-term solution.
Let's go to line now. Phyllis is on the line. Hello, Phyllis.
Hello. I haven't got the back problem. Well, I have, but it's not the same one as I'm asking about. My son, he's got severe pain in the buttocks, but it is to do with his back because he's had MRI scan, and they say he's got a couple of nodules on his spine. So, is there any treatment for this?
Gentlemen?
And I wouldn't. It's a bit unclear to me what these nodules are, so I wouldn't be in a position really to comment without knowing what's really involved.
Yeah, I'd agree. I mean, nodules isn't really a medical term, but if you can get hold of the original report from the MRI scan, then someone in James or my profession would be able to make sense of it and obviously advise.
And if he did go to a chiropractor or osteopath, which is the best really for the bottom of the spine?
Well, both my guests would say both.
Yeah,
I thought so.
Just find someone that if possible that is personally recommended as someone to trust and someone good, and I'm sure you know it's a good place to start.
Okay.
Right, thank you.
My wife has suffered from severe lower back pain for more than 8 years now. During this time she's had MRI scans, epidural injections, facet joint injections, needle and laser acupuncture, physio and hydrotherapy, together with numerous drugs. She was eventually told that she had degenerative discs and would have to learn to live with it by the specialist. We both felt very upset and angry that they seemed to have given up and left her to suffer. She's 54, in fact she's 54 today, feels older, has little social life, and wakes up most mornings in tears with the pain. Any help or advice?
Right, and happy birthday. Cases like this are not uncommon. We often find that it's the people who have been suffering for years and years and tried everything, then they land on our doorstep. And in very many cases, we're able to help. And I would suggest that it's worth giving it a try. It won't hurt to try.
You'd go with that as well, wouldn't you, David?
Yeah, I would. I mean, there's no magic bullets, and some people, would add us to the list of things that didn't work, I guess. But there are many cases that do get better, and obviously they're the ones that are glad that they did try.
Okay, let's go. Ron's in Telford. Yes, Ron?
Hello there, how are you?
Very well. Quick as you can, Ron.
Righto, I've had 2 hips done, and since I've had my 2 hips done, I've had a bad back. And the only thing that's any good for it is Osteocare tablets.
Gentlemen?
Osteocare tablets.
And that's helpful for you?
Oh, yes.
Oh,
That's
excellent.
my specialist said, keep taking them.
Oh, yes, good advice.
If they work for you, Ron, I wouldn't change that then.
Well, I've also got people that suffer with the knees in the early stages, and they've tried them, and they find them very, very helpful.
Well, if something's helpful and it's not doing you any harm, I don't think anybody around here would say stop. If it's helping you, it's helping you.
It's giving the bones what they're lacking. So, I think it's good.
Well, that's good news. Thank you. Jean's in Brosley. Yes, Jean?
Oh, good morning. No, good afternoon.
Good evening.
What I want to know is I suffer with peripheral neuropathy. In one foot worse than the other. But I'm also seeming to get quite a lot of pain and everything in the lower back. And I'm wondering, can this peripheral neuropathy affect the spine and the lower back? Or is it, as I've been told, only usually goes as far as the knees?
I'll try and help on this one. Jean, may I ask, what's the peripheral neuropathy down to? Have you been told? Is it diabetic related?
No, excuse me. No, they don't know why I've got it.
Okay.
I've had numerous tests, and only yesterday again the doctor said, no, you're definitely not a diabetic because the tests have just come back clear again for that. So I really don't know, and I don't think anybody else knows either.
Well, I mean, problems in the back, as we've talked with a few people already on today, can cause nerve problems. So, if they're not sure why that nerve has become painful, then the back is a possibility, and if the back hasn't been investigated, then that may be something to consider. And, of course, if it was the back that was causing the nerve problem, then, of course, that could also cause you to have back problems. Otherwise, of course, you were allowed to have 2 problems. Unfortunately, there's nothing that stops us having more than 1 problem at any one time. But if you've got 2 painful problems at any one time, they tend to make each other worse anyway.
Okay.
Right.
Well,
and could you tell me, is there anything better than gabapentin to take for this peripheral neuropathy?
From a medication point of view, gabapentin and pregabalin are the 2 things that tend to be used. But pregabalin's rather expensive, so it's not prescribed regularly, but it's not something that James and I do prescribing these, so you'd have to see either your GP or be referred to a pain medicine specialist to have a look at that.
thank you. A couple of quick ones here. Let me throw them at you. Quick answers. What can I do to get help with cervical spondylosis? Had an MRI scan. Will it get worse? Been suffering for 5 years.
Well, we find that if the joints lock up and they don't move, there's deterioration in the facet joint and in the disc joint, and we very often find that people with this, with a gentle approach of treatment, encouraging movement in those joints, help to the synovial fluid and the general circulation in the area, and a lot of cases like that respond really well to chiropractic treatment.
Gentlemen, we're going to have to leave it there. To our listeners who haven't been able to get on the air, may I suggest that you go and have a word to your GP and see if they can refer you somewhere, because it's not fun and the pain is awful. So go and check it. We'll be doing another program of this nature in the near future.